I think it is so embarrassing to wait in a line.
Why?
I am humiliated waiting in a line. Not because I think I'm better than. I just think how fucking embarrassing for grown-ass adults to be standing waiting for something.
Mm-hmm.
Like, calm down, chill.
I feel like that's why I DoorDash and Instacart a lot because I hate waiting in line so much.
I get so like, oh, look at you trying to complete a task. And everyone's, oh my God, get in line for an airplane, forget it.
Oh, I get
so embarrassed.
irritable. So irritable.
Oh my gosh. I want to, the irritability, yes, but it's like a deep shame. Like, I cannot go to a buffet.
I hate buffets so much.
Nothing more. Oh, you're holding a little plate like a grown man getting ready to put food on it. Like, I don't know what it is about that.
To me, it's just too much work.
I get so embarrassed.
Yeah.
Like, that's why the first thing I asked you was like, girl, are they plating our food at your wedding?
Yeah.
And they did.
Oh, that was literally a non-negotiable.
Yeah.
There was not a buffet in sight. That wasn't an option. Like, I would work myself into the ground to not have a buffet.
Hey everyone, and welcome back to this week's episode of your weekly therapy podcast. My name is Tel Williams, or Mr. Williams, teacher, therapist, social worker, and over here we have...
I'm Anne-Marie DiPietro, and I'm still a nurse practitioner.
You're still here with us.
Yeah. You know what I was thinking?
What?
You've literally not once let me introduce the podcast.
I know. I was literally talking, was I like, why am I always introducing it?
I know.
Give it to us.
You do have a better announcement voice, though.
I don't know that.
Hi, everyone, and welcome to your weekly therapy podcast. That's how you say it.
Yeah. But then, like...
Hi, everyone.
And then it goes back to a normal voice, though.
Yeah. It really does.
Oh, my God. How are you feeling? So like, you had a rough time coming in
terrible.
today.
It was so bad.
Usually I'm the one that's late, and we were both like out there at the same time.
I know. You know what? It was rough when I'm late.
Yeah.
What do you want me to tell
I want you so badly to tell it because
you're just embarrassed about the fact that you told everyone when you shit yourself and got diaper rash.
It's like, you know what? I think that we need to even the playing field of me
Yeah.
talking about shitting my pants and getting diaper rash.
Yeah. So I'm on an antibiotic, doxycycline. And usually I'm fine with it. In college, I wasn't. Had a little nausea, vomiting incident. But, like, since then, I've been fine. So, and I very rarely throw up, like, ever. Like, literally
It's
never.
not something you do.
No. The last time I threw up was the day before I proposed to Colleen, and I was giving a drug talk, and the car that they got me, the dude clearly smoked. And then I got, like, so car sick. That was, like, how long ago did we get engaged? Like, years ago.
Yeah.
So anyway, so this morning I take the doxycycline, then I get ready, then I take my other medicine. That was the problem, I think, because I went to swallow my other medicine and I was like,
Yep.
But then I was like, I'm going to will it away. I can will it away. It's fine. It's fine. Colleen's like, run your wrist under cold water. I'm like, okay. So I'm like, okay, I'm going to be fine. So I tried to go, I was driving to the office, right? Which is literally 6 minutes from our house. And I get like halfway there and I was like, oh, no. What do I do? So I like grab this bag that's a full bag,
Like,
but
stuff
no
in it.
idea what's in it though. And I'm like, I literally vomit into this bag while driving.
With stuff in it. No.
Right? Yes. And do you think that plastic grocery bags are like strong at all? No.
I didn't know it was a plastic grocery bag. I thought it was like, I don't know, a
Right.
shopping bag or something.
Right. So I had to rush to the office because I needed to heat press something before I came. So I didn't have time to take care of the vomit bag.
What do you mean you didn't have time, baby? Just throw it away.
Well, here's the thing. I was like, I don't know what's going to happen to it. I don't know. For some reason in my head, I was like, I'll take care of the vomit bag later.
No.
So then I go to Wawa and I'm like, all right, I'm going to take care of the vomit bag. The integrity of the bag was not good. Yeah. Luckily, there was a notebook under it, which absorbed. Excuse me. Jesus.
Don't do it again, bitch.
No, I'm not.
Not here, not like
good.
this.
I'm good. What if I did? That would be horrific. You'd be like, we're not cutting that out.
Keep it in.
And then, so I had, Jason got me that bunny Betsy Johnson bag.
Oh my God,
It came in like one of those cloth bags.
Yeah.
which for some reason was in my car. Like, of course it was.
Yeah.
So I put the vomit bag in that bag and just like straight up threw the whole thing out at Wawa. Still no idea what was in the bag.
You know what, though? Here's my thing. If you can't remember, it probably wasn't super
No,
important.
it was probably fine.
Yeah.
I think it might have been candy. I know.
No, it was important.
I know.
No, you know, not my candies.
Yeah, it was pretty heavy too. But I was like, I cannot look.
No.
I can't look. We can't
good
risk
candy.
it. It probably was.
Like Easter candy.
Yeah, but I bought more candy at Wawa, so it's fine.
You live to see another day.
Yes, it'll be fine.
Actually, I'm not going to lie. That makes a lot of sense that there'd be something in a bag that you were like, I forgot what this was. I forgot what I bought.
1,000%.
Today we're talking about ADHD, and something that Amber and I talk a lot about is that like we will rebuy something that we know we already have, or we forgot we already bought it, but we just don't know where it's at.
Right.
100. Like today.
I just did that last night.
What'd you buy?
Well, I have a craft show on Saturday, and I was like, Colleen, can you find the tablecloths for the tables? And like, Colleen also has ADHD,
Yeah.
so like, you know, she has a one-track mind. Like, she's just going like lacrosse game all day today. So I was like, well, I'll just buy another one. I have no less than 7 tablecloths somewhere.
Oh my gosh. For the
craft show.
Yeah, the folding tables though.
Yeah, exactly.
Oh. And here's the thing. After a while, I mean, that's not a bad thing to have a lot of tablecloths because like then you don't have to rewash them constantly, I guess. But like
I do craft shows like a few times a year.
Yeah. So it'll be great. That's an investment, babes.
Whatever.
You know? I never, ever, which is gonna probably piss people off, but I never bleach my teeth. Because I'm just like I don't know, because it hurts.
Blah.
And so when I went to LA, I was like, I'm gonna bleach my teeth before this. So I got the like crust kit that like also has the light on it. I don't know how, and I thought I messed up, and I didn't because it shows. I bought it twice. So like I'm in LA and I get an alert that there was an Amazon delivery, and I'm like, oh, Jason, what do you buy now? And it was another crust thingy.
Oh yeah.
But I don't know why I bought 2.
Who knows? You probably put it in your cart and then put it in your cart again.
That's exactly what I think I did.
Yeah.
But I'm like, and I used it before I left. So it's like I knew I had it.
Yeah.
And I don't know why I did it again.
I used to do these like huge orders of clothes online, and I would like not realize I ordered multiple things, and then they would come and there would literally be multiple of the same shirt or pants in one order.
I do the same shirt often because like, again, you don't have to wash it as much. And like, if I like it, like I bought this tank top in every color because I'm like, I like this tank top a lot. So I got white.
Yeah.
And a different shade of gray and a green and a red and all that.
There's one nail glue that I like, and I've only ever found it on Alibaba. I don't know why. And so, but now there's this like restriction from China where they can't mail it. They need to get like a waiver to mail this glue. And every time I order like 25 glues, I'm not even kidding, 25, because I'm so worried that I'm not going to be able to get it or I'm going to lose it or...
Some people like stocking up with like corn and like beets for the end of the world, and you're like...
Nail glue.
Nail glue.
Mm-hmm.
You're like, I can't live without it.
Yeah.
It's in the bunker, baby.
Right. I said to Colleen's friend, I was like, you voted for Trump and it's your fault. I don't have fucking nail glue.
Yeah. You know what? It's like, what is the president going to do about the nail glue situation? You know?
Exactly.
Like, put that in the signal messaging.
Yeah.
Okay?
Yeah.
Like, that's top secret, babes.
Right. But right now on my kitchen table, I have 2 boxes of 25 nail glues because I finally found someone who had the waiver to send it to me.
I thought you had to get the waiver. I was like, who do you have to contact?
No. But before, it used to be 25 cents. This time I had to pay like $3 per nail glue.
That's too much for me.
I know. But it's worth it.
It's
fine.
The luxuries in life of the nail glue.
I know.
All right, so today is fun. I asked people their ADHD questions.
Yes.
So we're gonna like talk about them, but then we're gonna also do an ADHD screening. So Anne Marie's gonna screen me, and so you guys can like follow along, listen to that, and then we'll talk about our own ADHD shit. But
yeah, because for the record, I am board certified to assess for ADHD.
Yep.
Besides the people online that are like, "Oh, she's so dumb" because of her voice. Like,
because of the fry.
Yeah, the fry.
It's
like I can still assess you
she
for
went
ADHD.
she went to an Ivy League school, babe. She's the Elle Woods of mental health, is what I tell clients.
Listen, I might wear a pink suit and talk like Paris Hilton, but I'm pretty smart.
Yeah. And Paris Hilton's pretty fucking smart. She's made a whole business out of
so is Kim
people
Kardashian.
Yeah. They've made a whole business out of people thinking they're dumb.
Yeah.
You know?
True. And isn't Kim Kardashian a lawyer?
I don't think like, yeah.
Oh, okay.
I don't know if that she's passed. I don't know if she can pass the bar.
Oh, I don't know.
So girl, pass it.
Right.
Like, what are you doing? Just do it. Okay. I was taking some questions before you hit the screen, though. What prompted us to get diagnosed? So, like, what prompted you? Like, what happened?
So I was 20 and I started working with this doctor in State College when I was at Penn State. And to this day, I was thinking about this on the ride here. There's probably no other human on the face of the planet that's impacted my life more than Dr. Mooney. Like, I think every day in my practice, like, somehow I think of something he taught me, whether it's ADHD, chronic fatigue syndrome, thyroid stuff. You know, he was great. And so I always had this problem with irritability. Like, people would be like, why is she such a bitch? Literally. And I had tried like a whole bunch of medications the first couple of years that I was in college, and like nothing worked. And one day he was like, maybe you have ADHD. And I was like, I'm way too smart for that. What do you mean?
Yeah.
And he like screened me and he was like, let's try to treat it. And I distinctly remember because I was the special events director of Homecoming. And it was right before our like whole homecoming week.
Yeah.
So I had like events every day and I started the medicine and I was like, I am amazing. Everyone was like, you are so nice. What happened to you? I was like, I think I have ADHD.
I have a new lease on life.
Yeah. And ever since then, ever since I was 20, so that was 5 years ago.
Yeah.
Just kidding, 18 years ago. I've been, is it really 18 years ago? Oh my God. That's so embarrassing.
That's a full adult ago.
Oh yeah. On the way here, I was listening to a podcast and they were like, you know, the DSM-5 is like pretty old now, like over a decade old. And I was like, I think of the DSM-5 as brand new.
Uh-huh.
Like, I practiced for like years before DSM-5 came out.
No babes.
And people are like, it's so old.
We got to update it.
I was like, oh my God. At least I feel young.
That's all that matters, you know, because then people are like, what, 18 years ago? There's no way, you know?
Oh my gosh, I have to tell you this story. This is total ADHD that this is happening right now, but this reminded me. So one of Colleen's girls on the lacrosse team, her boyfriend was, I was talking to her and her boyfriend, and my favorite game to play is like, tell me how old you think Colleen is, right? So I'm like, how old do you think Colleen is? And he's like 30. Fuck you, bro. Really? Really? Bitch is 43. Okay.
Did you ask him how old he thought you were?
Here it comes.
Oh, no.
So I was like, how old do you think I am? And he turns to his girlfriend. He's like, she looks like John's mom. And I was like, what? You're 18 years old. I look like an 18-year-old's mom. I mean, I could have an 18-year-old, but I was like, so let me get this straight. Colleen looks 30 and I look like your friend's mom.
And he was like, yeah.
Yes. Yes.
I've been like, she's no longer starting.
Right.
She's cut from the team.
Change the lineup.
I don't feel good about it.
She's done.
She should not be on the team.
No.
Like, very toxic energy coming from her. Like, not a team player.
For sure. Yeah. I mean, I was like, oh my God. So the next day I was going to get Botox and I was like, we need to increase my units, Nikki. Because I cannot look like an 18-year-old's mom.
I don't want to move my face ever again.
When my wife looks 30.
I don't play that game anymore. I don't play that.
I'm never playing it again.
No. Because kids are going to hurt your feelings every time.
Oh my God.
Every time.
I think in my head, like, oh, I'll be so flattered that people think my wife is so young until I ask them how old they think I am. And then I'm like, I immediately regret this.
There's going to be a day that you stop playing that game.
It's today. It's today.
It happened.
Yeah. Like, I don't think, like, the kids on the baseball team are hitting on me, but they're sure as shit hitting on Colleen.
Because they're like, she's 5 years old, or she's 25 years old.
Right.
That's
and I'm
so
like,
funny.
she's a lesbian.
Oh my God. she's a 43-year-old. That's so funny.
I know. Anyway, back to ADHD.
ADHD.
Tell us about you getting diagnosed with ADHD.
Well, the first time I got diagnosed, I was 5 years old. I think.
Right. I forgot about that.
I was diagnosed with autism, ADHD, a speech and language disorder. I was diagnosed with aphasia and dyslexia. I was really, really, really young. And then was never
But you didn't know any of that.
No, my mom never told me. She thought it'd be like a fun little game. And
Find out after I'm dead.
Find out when I die, or not even when I die. Find out several years after I die, and then when I found out at 29, was it 29, 28? How old was I? 20
How
or
long
29?
have we known each other?
4 years, something like that.
So subtract.
Yeah, 20 or 29. Jason got diagnosed first, and then was like, "You need to go see my friend Anne Marie and get screened, babes." And I was like, "Jason, I'm bipolar. It's fine." And I was not bipolar, and I was not fine. I was aggressively ADHD.
And binge eating disorder. Don't forget that.
Horrific binge eating disorder. I think I was eating like 10,000 calories a day.
And you were literally like, "Oh, my eating's fine.
Yeah.
Like, I don't have an issue. I just like binge sometimes, like every day."
Yeah. Every night I would eat because this was during COVID.
Well, I don't even think you used the word binge.
I didn't. I said
Yeah.
I said I just like really can't stop eating. And I didn't think it was like an issue because I also had I was starting to see a nutritionist, and he's great. I still see him. And he didn't think to ask, like, because he was seeing what I was eating. He's like, "Yeah, that's like not bad." But then he got to a point where he's like, "How much of it are you eating though?" And I also wouldn't tell him I was eating a quart of ice cream every night, not a pint, a quart of ice cream every night. And yeah, he found I was eating like 10,000 calories.
Mm-hmm.
And then when y'all got together and we're like, "How do we best help Tell?" That dramatically changed. I mean, I remember the first time I took my med, I was in graduate school, and I was at the airport reading a book we had to read for class, and I took the medication. I took Vyvanse for the first time, and I'm dyslexic, so reading is always super fun and challenging for me.
Mm-hmm.
But I was at the airport, and I cracked open the book, and I got there like super early, so my mother-in-law dropped me off, and I was like getting ready to get board of the plane. I realized I had almost finished the book entirely, and I started crying. The woman's like, "Good book." I'm like, "No, I just finished a book." And she's like, "Jesus." Like, this woman had no idea who I was. And I was like, "Guys, I'm reading." Because it helped. It helped me like be able to actually sit and read and not see the words backwards.
Well, we should also say lisdexamfetamine, which is the generic of Vyvanse, is also FDA approved for binge eating disorder as well as ADHD.
Dude, it was like a 2-in-1 for me. Because then I was like, oh, like, I don't know if you guys know what food noise is, but it's like when the constant like voice in your head is like, you got to eat something. You're hungry. You need to eat something. Like, what are you going to eat? What are you going to eat next? We should eat something right now. Because you're just trying to like, stimulate any part of your body. And that was gone. And so I was like, oh, this is how you eat an appropriate amount of food. Like, or like not everyone just thinks about like what's the next thing they're going to eat. Wild behavior on my part. Okay, this is something I actually, as a therapist, I'm not going to lie, I don't know that I know the answer to.
Oh, I hope I do.
I know. Well, I think you will.
Okay.
I just like don't. Yeah. Is ADHD something you're born with? Which I know, yes. Or also though, can you develop it as you get older?
Okay, so this is a very complicated question.
Yeah.
So let's talk about ADHD in women first.
Yeah.
So women have a unique challenge because really the DSM was written for boys really, not even men.
Yeah.
Because it presents differently in women. And what research has found, and let me say the research is scant on women with ADHD. However, we do know that it depends on hormones. So when estrogen is high, which is like the first 2 weeks of your cycle, day 1 to 14, you have less ADHD symptoms. When from 14 to say like 28, your estrogen decreases and your progesterone takes over. And that's when you see more ADHD symptoms. Right. And that's why a lot of times with women, they'll say that their medicine doesn't work as well when they're on their period. I hear that all the time. And there was actually a study in the Netherlands, I don't know, a couple years ago, it's not that old, on flexible dosing of ADHD medicine based on where women are at in their cycle, which, to be honest, I do already with my female clients with ADHD. But if you think about it, right, you see and hear about a lot of perimenopausal and menopausal women who have basically masked their whole life ADHD, and then when their estrogen drops, they're like, why do I suddenly have all these raging ADHD symptoms? Which TikTok and Instagram have helped with this because women are aware of things that we could never educate before. And that's why, because your estrogen level is lower and your symptoms become more prominent and you're less able to cope. So the very long answer is symptoms fluctuate throughout your life. So you may have this developmental disability or you may be neurodivergent your whole life, but that doesn't necessarily mean, one, it's going to impair your functioning.
Yep.
And two, that it's clinically relevant at all stages of your life.
No, I agree. I think that, like, well, we're perfect examples. We were diagnosed later in life, right? I learned to mask and to operate. Like I say, like, having ADHD is sometimes like operating like an octopus. You have, 8 arms and can do all these things. But that's not good. Like, you're not able to, like, multitasking isn't a thing. Your brain can't do more than one thing at a time. You're just flipping back and forth. And I say ADHD is like going from 8 arms to 2, and everyone operates in 2, and it's better and healthier for us to do that. But we have to relearn, right? So, like, I was fine until I wasn't. I was fine. I think a lot of people were fine until, like, COVID, and then they realized when they tried to, like, reoperate in the world after some time off, I say that sarcastically, but, like, yeah, I think it's definitely something you're born with. It's there.
Right.
I think just like when it decides to.
Another problem is that ADHD co-occurs with anxiety and depression between 20 and 50% of the time. And also about 20% of the time coexist with depression and anxiety.
Yeah.
So a lot of times, especially in women, you'll present to a clinician and the clinician will see depression and anxiety and won't look beyond ADHD. Because to be honest, for a clinician that is qualified to diagnose, there's like a stigma about diagnosing ADHD. Like, you don't want to be, quote unquote, that person that diagnoses ADHD all the time.
Well, and let's say clinician, and what I'm thinking, it's your PCP, babe. I'm thinking PCP because a PCP is like very unlikely to want to give you a stimulant, and they love to diagnose women with anxiety and depression.
For
Because,
sure.
baby, don't be diagnosing ADHD after 5 minutes of sitting down with them, and you're sitting down with clients for an hour plus when you're doing your diagnoses. Easily an hour plus.
Yeah.
Yeah.
Lately, like 2 hours,
Yeah.
2.5 hours. Yeah.
So, because I know you're not that girl that's like anxiety, depression. There you go. Bye bye.
No. I always screen for ADHD.
Yep.
Always. Every client before they come to an appointment do self-assessments for everything.
Yeah.
But there's 2 ADHD assessments that I have them do. And then I do my own assessment during the appointment. Because you have to assess both for childhood as well as adulthood, or at least I do. And one of my biggest pet peeves, though, is some clinicians, whether it's primary care or even psych, will send the person out for this, like, quote unquote testing that is extremely expensive, that there's usually a waiting list for. And ultimately, there is absolutely no scientific evidence that it's diagnostic whatsoever.
Is this the one that's like 8 hours long?
Yeah.
I get
It's
so
screening.
angry.
Bottom line, it's screening.
Uh-huh.
Now, for example, there's this assessment that I actually brought to give to you, which is called the DIVA, the Diagnostic Interview for ADHD in
The
Adults.
DIVA!
I know, it was basically made for us. But it has, 90 to 97% sensitivity and 77 to 90% specificity, which means that 90 to 97% of the time it will accurately diagnose someone with ADHD. And 77 to 90% of the time, it will accurately not diagnose someone with ADHD. So it's both strong in both ways, meaning it will catch the people that have it, and it will not leave out people that don't.
It's wild to me that I think quite a bit of people have ADHD, and I think if anything, it's like underdiagnosed. But I think it is wild that you're right. There's so many clinicians like, no, it's anxiety or depression. The amount of people that come in that are like, Anne Marie diagnosed me with ADHD, and, which makes sense. But I do have a lot of anxiety and depression. I'm like, start your medication and therapy here. And the amount of people that are like, my anxiety and depression is either gone or it's decreased. And I'm like, well, if you think about it, not being able to emotionally regulate or to sometimes to have, like thoughtful or less anxiety-induced social interactions or be able to pay attention to things you're doing, like all that causes anxiety.
Right.
Like 100%.
Well, also, like if you're not getting anything done, you have things to do, you don't have the motivation to do them, you don't have the ability to focus on them, to start them, to finish them, you get anxious about all of this stuff that builds up. And when you're anxious, you get what's called learned hopelessness, where it's like that experiment with the dog where they took a dog and they like shocked the dog on one side, so it jumped over to the other fence, and then it jumped a few times, and then it just like laid down and let itself get shocked, which is basically what learned hopelessness is. So it just like perpetuates the cycle of ADHD symptoms, anxiety contributing to not starting, not finishing. So, and a lot of times the clinician sees the anxiety. And so I'll see people who've been on like 12 different anxiety medicines and even mood stabilizers like you were. And I'm like, usually of, 28 medicines, you'll find something's
going to work.
Right.
Yeah. I think that was the thing that was so frustrating. The only thing that worked for me was lithium, and that didn't work because I wasn't bipolar.
Right.
And so you think that at one point a doctor would have been like, hey.
So one of the good distinctions, I think at least, with the irritability and emotional dysregulation of ADHD is that it's always present throughout the course of a day. So you might be having a good day and then it turns bad, and then it might turn good again. And then the next day something happens and you're emotionally reactive, versus with bipolar disorder, you might have a good week, you might have a good 2 weeks, you might have a good 3 weeks, then you might be depressed for a week or two. Even with rapid cycling with bipolar disorder, it should be like a 4-day mood episode.
And I think that like when I was telling the doctor, they're like, oh, it's happening daily that I'm going through these mood swings. I mean, it was really just like emotional, like the world's ending, no, I'm fine now. And I was just like, I would have diagnosed me with something other than even bipolar disorder with how rapidly I was, But then again, I always say if you I think I've said this before in the podcast, if you're taking a stimulant, people I think that you're going to be up and super hyper and excited, but like Jason takes his Adderall and then goes take a nap. Like, you know what I mean? Like it should calm you down. If you, it's the opposite effect.
Right.
I always thought, oh, it's because I'm Puerto Rican that I can like chug a coffee and then just go to sleep at night. I'm like, baby, it's not.
Clients tell me, clients will ask me when I prescribe ADHD medicine for the first time, how will I know it's working? And my answer every time is, you'll know. And then they come back and they're like, for the first time, my brain was clear. Or a lot of times I'll hear like, I didn't rage. Yeah.
Isn't that wild? It's like I love that you'll know. Like I'm not even gonna like tell you. You'll know it's working. It's the weirdest feeling. I'm like, because it's not like you are, I don't know, like high or stoned or anything like that. It's just it's very surreal. It's like, oh,
your brain's
quiet.
Clear.
Yeah,
it's quiet.
I'm like, and then I got so angry that I'm like, this is what everyone else feels like. That's annoying. Let's try the screening a little bit. I don't know how long it takes, but like, let's try it.
Okay. I'll do, let's see. So I have a bunch of screenings that I use, but the Diva is really made specifically for adult ADHD. So the thing I like about it is it's based on DSM criteria, but then it gives examples. So rather than me say, do you often fail to give close attention to details, or do you make careless mistakes in your work or during other activities? I can say, like, do you make careless mistakes?
All the time.
Do you work slowly to avoid mistakes?
Yeah.
Do you work and it's inaccurate?
Yeah.
Do you read instructions carefully?
I'm going to say no to that one.
That's right. I tried to trick you. Do you overlook or miss details?
Yeah.
Do you feel like you spend too much time completing detailed tasks?
Yeah.
How about when you were a child?
No.
Did you make careless mistakes in school?
Uh-huh.
Would you ever like leave questions on a test unanswered by accident?
Oh, absolutely.
Did you not check the answers in a test or homework afterward?
I didn't know that. Yeah, I didn't know people did that.
What? Checked over their work?
Why would you do that? like just move on, babes.
Yes, for sure. Would you get quickly distracted by your own thoughts or associations?
Yeah.
What about watching a movie? Is it hard for you to watch the whole movie to the end?
Yes and no, because sometimes I always read the synopsis of a movie.
It also doesn't count if you're doing 7,000 other things while watching
Then
the
no,
movie.
then yeah, it's very hard for me to finish a movie.
Yeah. Well, and you already stated it was hard for you to read a book before your medicine.
I did.
So.
Yeah.
Do you feel, this is a good one, do you feel like you quickly become bored with things?
Yeah.
A lot of times my clients' parents will bring them in and say they're depressed, but what it really is when I talk to the client is they're bored. They'll literally say, like, I'm bored all the time.
Mm-hmm. Yep. Like, yeah. Do you have anything to look forward to or anything? Like, yeah.
Mm-hmm. Do you ever ask questions that have already been answered or discussed, but you just forget?
Yeah. That got me in trouble a lot in school.
Okay. I'm not going to ask all the questions about childhood, but in this assessment, there are questions about childhood as well. Do you have difficulty concentrating on a conversation?
100%. I just opened a folder as you were asking that.
Oh my God, stop.
My medicine hasn't kicked in yet.
When you're having a conversation, do you ever have the conversation and then afterward not remember what the conversation was about?
Oh, for sure.
Okay. When you're having a conversation, do people ever tell you that it seems like you're not listening?
All the time.
Okay. If you're not distracted, do you feel like your mind still seems elsewhere?
Yeah.
Okay. Do you ever start tasks but then get easily sidetracked?
Yeah.
Does it help if you set a timer to complete tasks?
Yes, if it's a short timer, very short timer.
I already know the answer to this. Difficulty completing administrative tasks. Difficulty managing multiple tasks. So if you have to do 4 things, is that harder for you than just knowing you have to do one?
No, it's easier if you have to do 4 because I can go back and forth between them.
No, that doesn't count. Sequential tasks.
Oh, then fuck no. God no.
Yeah. I figured. I was like,
no. If I can go back
that.
and forth,
No.
I can do it, but no.
Yeah. Do you consider yourself organized?
Nope.
Okay. Do you lose things often?
Yeah.
Do you often arrive late?
Everything.
Everything.
Yeah, absolutely
For
everything.
sure. To the podcast every week.
Every time.
Every time. Do you fail to meet deadlines?
All the time.
Like when you submit your billing 3 months after?
Yeah, 100%.
Yeah. I already know the answer to this. Is it hard for you to use an agenda or a calendar?
Absolutely it is.
Your husband loves that about you.
I one time triple booked people.
Oh, yeah. Yeah. I love how he made a Google Calendar for you, but you still change it all the time.
I do use that now, but I still, I'm still fucking that up somehow.
Do you create schedules and then not use them?
Well, look at that. Yes, we do.
Mm-hmm. Well, we just said this,
Yeah.
needing other people to structure things.
100%.
Yes. Okay. If you're doing a list of tasks, which ones do you do first in terms of easiest or hardest?
Oh, the easiest ones first. Do people usually do the hardest ones first?
No.
Oh, thank God.
I mean, normal people do.
What,
I mean, I should say people without ADHD.
neurotypical people.
Neurotypical
people.
Yeah. Don't do the easiest things first.
Why?
I don't know, because they can not avoid stuff.
Yeah, well, I've found out that neurotypical people get dopamine after completing a task. Like they get a flood of like, oh, I accomplished something. Like it physically feels good.
Mm-hmm.
We've been living our whole lives without that task. So that's why I tell people, like, you're not lazy. You don't get what everyone else gets when they finish it.
Mm-hmm. True.
What the fuck?
I know. Not fair. We already talked about how you don't like reading.
Mm-mm.
How about completing forms?
God, no. God, no. Who
I'm
likes
literally so bad at that. If you text me one more fucking time asking me if I filled out a form, I'm going to lose my mind. Remember that day I was like, Tell, I'm fucking tired and the form can wait.
Yeah, I'm like, it can't though.
I will do anything to avoid a form. Do you spend a lot of time searching for things?
Yeah.
How often do I search for scissors?
Girl, we have so many scissors too.
Can never find them.
At our house, we have to have like 10 pairs now, and there's one tiny little pair in the kitchen. We can't find the other ones.
I could have things in my hand 1 second and then they're lost.
Gone. It's
and then I spend literally like 20 minutes looking for something I just had in my hand.
I've cried over that.
Yeah.
Because I was
me too.
you've had it all day, and it's just, you said, because I used to think I would get, but this was before I was diagnosed, that I just got excited, and I would just I would look down and it was gone. It's so maddening.
It really is. It really is. Do you feel like you get overstimulated and it's hard to shut things off?
Yeah.
What if other people are talking around you? Does that distract you?
Yeah.
Do you often forget appointments or other obligations?
Yes.
Do you need frequent reminders?
Yeah.
Forget to pay bills? I already know for a fact you don't pay bills.
No, my husband does all that.
Yes.
Yep. Or it's on automatic pay.
Yeah. Colleen was listening to the podcast the other night, and the part where we talked about lavender marriages, and she was like, literally, you and Tel could not function together. You could not be together if you wanted to.
We would be like, what's it called? Evicted, because
we would
just
pay
forget
no
to pay
bills.
things.
We would forget to eat.
Yeah.
We would just be like ordering DoorDash.
Constantly.
Yeah.
We'd be ordering scissors.
Yeah, seriously. Right. We'd be DoorDashing scissors. Do you have to return home often to fetch things you forgot?
Yeah.
You do. That's why you had to get a desktop, because you always forgot your laptop.
Y'all, I had to buy a actual desktop computer for the office because I would forget my laptop at home and couldn't see clients.
How about forgetting to do chores or run errands?
Always. Difficulty
sitting still.
Yep.
Fidgeting.
Yep.
Fiddling with hair or biting nails. As I'm like,
yeah.
Often leaves your office or workplace.
Yeah.
Avoid symposiums, lectures, churches, etc.
Oh, well, fuck yeah.
Do you get stressed about not being able to sit still?
Yeah. The bouncing leg thing. Yeah.
Do you ever make excuses to walk around instead of sitting?
100%.
Do you find it hard to relax?
For sure.
Do you feel restless?
All the time.
A lot of times restlessness is perceived as anxiety. That's another good point.
And because my mom used to be like, Tell, calm down, because I would shake my leg. She also, again, the autism didn't tell me things, so I would be like, rocking or whatever, and I'd be like.
Stereotypical behavior.
Yeah.
Do you feel like you constantly have to be doing something?
Always. Unless I have burnout.
This is interesting. Becoming quickly too cocky in public.
Ooh.
I don't think you do that.
I don't know. I think I'm too self-conscious. I think I might appear that, or I know I am definitely put on a facade to do it, but I'm never confident in that.
How about being loud in all kinds of situations?
I would say all kinds, but I find myself sometimes randomly loud and I don't realize I'm screaming.
Yeah. Do you have difficulty doing things quietly?
Yeah. Ask my husband.
Yes. We already talked about you're always busy doing something. How do you do with boundaries?
I had to learn to be good at them. I'm not naturally good at. I am better naturally with them now, but that is something that I had to work. When I say hard, I mean very, very actively hard on. It did not come natural to me at all.
Do you interrupt people often?
All the time.
We both interrupt each other a lot, which is probably pretty irritating to everyone else.
Yeah.
Do you say things without thinking first?
All the time.
Do you complete other people's sentences?
Yes, and that's something else I've had to stop doing that I've worked very hard on not doing.
Do you often find it hard to not say what you think?
Yeah. A lot of this is difficult, too, because I always say that that ADHD and autism is more of a Venn diagram and becoming more of like a circle because they're both, the neurodivergence. But I had an occupational therapist. So some of these I don't do, but I actively don't do it, if that makes sense. Like I'm constantly thinking of like, don't say that.
Yeah. That's the thing. A lot of people will not get diagnosed in childhood because their adaptive skills exceed the challenges of ADHD. But as they get older and the ability to compensate gets harder, a lot of times you'll see symptoms, which is another answer to that question about are you born with it or do you develop it at some other time? I think it's a lot about coping skills and strategies.
Oh, absolutely.
Do you like waiting in line?
No, and who does?
Well, I think people are more tolerant of it than others with ADHD.
Oh, no. Can I tell you something about it? This is the ADHD and the autism together. I think it is so embarrassing to wait in a line.
Why?
I am humiliated waiting in a line. Not because I think I'm better than. I just think how fucking embarrassing for grown-ass adults to be standing waiting for something. Like, calm down, chill.
I feel like that's why I DoorDash and Instacart a lot because I hate waiting in line so much.
I get so, like, oh, look at you trying to complete a task. And everyone's, oh, my God. Get in line for an airplane? Forget it.
Oh, I get
so embarrassed.
So irritable. So irritable.
Oh, my gosh. I want to, the irritability, yes. But it's like a deep shame. Like, I cannot go to a buffet.
I hate buffets so much.
Nothing more. Oh, you and you're holding a little plate like a grown man getting ready to put food on it. Like I don't know what it is about that.
To me, it's just too much work.
I get so embarrassed.
Yeah.
Like that's why the first thing I asked you was like, girl, are they plating our food at your wedding?
Yeah.
And they did.
Oh, that was literally a non-negotiable.
Yeah.
There was not a buffet in sight. That wasn't an option. Like, I would work myself into the ground to not have a buffet.
The only thing that was like you go get was the dessert. And when I tell you, I've never seen, you had 3 rooms with dessert in them. I've never seen so much dessert. You would go into a room like that. You're like, oh, this is, and dessert. Like, there was dessert everywhere.
Yeah.
That was,
Yeah. Luckily, they gave us our own like attendant or like waitress or whatever. So like I didn't have to get anything at the wedding,
No,
or I would have gotten nothing.
You were like, I'm not waiting in line.
Yeah, no, there was no line to be waited in. And at the airport, you know how they say like active military can board first. So that was like the best part about dating someone in the military because I'd be like, no line.
Yeah. Boo. Boo,
I'd be like, come on, Colleen.
Running.
And Colleen was so embarrassed, like going through. And people would like look at us like, oh, you're boarding with the first class people. Like, why are you in line? And I'd be like, she's in the military. You're welcome for her service.
Right.
She was mortified.
But also, like, she's done enough. She deserves to board first. Like,
right.
Like, let our vets board first.
She would have boarded in group 5
if
100%. It was up to her.
She would have been like, I'll write on the back of the plane. You know what? Just like put me like with the cargo.
Right.
It's fine. Yeah, 100% she would have. Yeah.
Yep. I'm the obnoxious one that's always like, oh, military, let's go. And then I would get so annoyed if the person like scanning the tickets didn't thank her for her service.
You're like.
And Colleen's like, it's so embarrassing when people thank me. And I'm like, oh, well.
Too bad. Take the compliment.
Yeah, exactly. Let's see. So do you feel like you often disturb other people when they're doing an activity or busy?
Yep.
But do you get annoyed when people interrupt you?
Yeah.
How about having an opinion about everything and immediately expressing it?
Yeah.
Let's see. Do you feel like you intrude on others?
Yeah.
Okay. So a lot of those symptoms that fits the criteria A through B, and then every diagnosis in the DSM also includes the functional impairment.
Mm-hmm.
So that would be like if you tire quickly of your workplace, you underperform at work, you have limited impairment through compensation of high IQ. That's a great point. Because if you think about it, why in school would a teacher recognize, I think this person should be diagnosed with ADHD even though they have straight A's?
Right.
That's not a thing.
You don't think?
No, I don't think teachers are like, this person has unless they're disruptive in the
I get what you're saying.
classroom.
100%. No, they're not.
Right.
But this is why we have so much burnout in people who work in the gifted programs who are crashing out.
I
It's
have a
like,
client
baby.
with 145 IQ, which is genius
Anne
level
Marie,
IQ.
stop talking about me. HIPAA.
That is so impaired by ADHD.
Yeah.
It's
Well, you said something, and I just like want to take a second to
Okay.
say it. You said, when you're asking these things, you said, do you feel like you intrude on others? That when I get so pissed, we talk about this a lot. We probably talk about this. I don't want to say too much because I think it needs to be talked about more. These are symptoms that you're talking about. If you're listening to some of this and you're thinking, oh, yeah. This is the shit we're talking about with ADHD, that it's so much more than not being able to pay attention. So when people are like, oh, people are overdiagnosed with it, it's like, you just sit down and do your work, or you just need to intrude on others, to feel like you're intruding on others constantly or whatever, that you're bothering others, right? It's just one part of it. But living with that for years and years and years and years, along with the other stuff, like you feel like you're bothering people, you feel like you're a nuisance to people. That is a
burden.
heavy load to carry. And people don't realize that is a part of ADHD.
right. It's so frustrating to me when people say we're overdiagnosing ADHD because the research shows that we're underdiagnosing it.
Thank you for saying that, because I was like, again, when it said confidence, I learned these statistics in school and I don't repeat them. We underdiagnose comparatively to some other countries because we don't fully grasp, well, we do, but we don't fully grasp what it is, right? It's...
Oh, we should talk about rejection sensitivity too.
Please do. Let's go to that.
So rejection sensitivity is something with ADHD where you feel like you're always a failure and you have these doubts about your ability to do things, so that when you get any sort of feedback, you usually perceive it as negative and saying something like basically reinforcing your feeling that you're a failure. So it's very hard for you to hear even constructive criticism or even feedback that makes zero commentary on you as a person.
Yep.
You take very negatively, personally. Yeah.
I think that's it. We could do an entire episode on rejection sensitivity and what's it called? Exposure therapy with it. The rejection sensitivity with me is so real. You're one of the few people that have been able to, like, as my supervisor, have to be like, don't do this, and give me the feedback in a way that's like, we're not gonna get sensitive about it, or you just kind of you just like straight shoot it, and then.
It took a little bit, though.
Yeah, because you'll straight shoot and then move on to something else real quick. And I'm always like, well, we didn't finish the conversation. I'm like, no, we did. She's just not letting me get upset about it. Like, when you're with this client, I need you to start talking to them about this. And you move on to something like, but what we need to talk about that because I don't think I should. And it's like, no, like, it wasn't a criticism. It was just do that.
That's why when you said that you were diagnosed with autism and you felt like no one could ask you questions about it except me.
Because I would be like, no, I would get so defensive. Like, no,
Defensive,
it's a trauma response because of this and this as a kid. And you're like, you said something at one point that was like, that's not, it wasn't, it's trauma, but that's not how someone would typically respond. I remember what it was because you said that, and I was like instantly, it was like a knot in my throat. I'm like, wait a minute. Yeah, that's like a moment of like, I just thought everyone in the world lived that way. Yeah.
Yeah. It might have been how you handled your friend's trauma, remember, with the death.
Yeah. That was heart-wrenching.
You struggle with that a lot, how you responded to it.
I had a friend whose parent passed away, and she was wearing tubed mascara, and she looked like a chimney sweep from like Mary Poppins. It was just like all over.
This is a great example of hyperfocus, by the way.
What?
You focused on that mascara so much.
I did, and she's finding out her mom's passing away in front of me, and I didn't know she's on the phone with her parent, with her dad. And I was like, this has got to be so hard for her. And so I took makeup wipes and I started cleaning her face while she's on the phone. Because I'm like, her face needs to be cleaned. And I remember, in a way, Anne-Marie and her related. And I told Anne-Marie about this and I was hysterically crying. I'm like, I just didn't do enough. I didn't do enough. And Anne-Marie, knowing her for longer than I've known her, you were like, no, you did enough. And then when I told my friend about this, after, she was like, I thought that was the sweetest thing someone could have done for me at the time. And I was just like, I
were so worried you did the wrong thing.
I really did. Because I was like, I cleaned her face. Like she's going to have to think about, like, when she found out her mom was passing away, someone started wiping her face down. And you're like, yeah, that's a kind. You're taking care. You're
Mm-hmm.
physically taking care of. Oh my God, I was for weeks. I
Mm-hmm.
remember calling you. I'm like, I'm just not good. I like wouldn't get
Mm-hmm.
out of like the couch at one point because I was just so upset.
Mm-hmm.
Yeah, it was
Yeah.
bad.
It was the mascara, and then just in general,
I'm not
like
doing
you
enough.
were,
Not checking in
yeah.
on. Not.
Mm-hmm.
Oh yeah.
But then it was like, am I checking too much? And
Yeah.
I think it was that like rejection sensitivity that you were so worried that someone was going to comment on how you handled it.
Comment or like. For me, the rejection sensitivity isn't even if they tell me; it's that I'm feeling it.
Mm-hmm.
Like and it's not that like they're gonna like. You have to think too. Rejection sensitivity doesn't mean someone's like rejecting you. It means that they're the critique, right?
Mm-hmm.
And my word was the critique was that it was harmful to them,
Mm-hmm.
or that it
you
wasn't
feel like
enough.
a failure.
100% felt like, oh my God, yeah,
Mm-hmm.
yeah,
I think part too why you accept feedback from me is that you know my intentions because we know each other so well and
Yeah.
have that relationship where I've given you feedback and you struggled with it at first, but then through knowing me, you know that I'm giving it to you to better you
Right.
and not because I think you're a failure. Because I also
Yeah.
give you a lot of positive reinforcement.
right. I think it's like that one time. I think we've talked about this before, where we had like, I don't even know if it was an argument, but
Oh my God, it was terrible.
and Amber was
I
like,
did not handle it well.
no, and I was like, I think this is both like rejection sensitivity, but also like trauma with other friends.
What were we fighting about?
It was literally about
arguing.
like,
Sorry,
it was
you
literally
hate
about
the
like
word.
starting like recording sooner or something. I don't remember. Like it was like if we were recording 2 episodes instead of 1. I don't remember. I honestly could not tell you because wasn't for me. It wasn't even an argument. And so I remember being like, hey, if I'm not frustrated and talking about it, then be
Mhm.
insecure about the friendship, because like if I'm talking about it or if I'm frustrated and talking about it, like I'm a talker. This is a good thing. It's when I'm just like, you know what, it doesn't matter. I actually don't care. It's not that big of a deal.
Mhm.
Like that. So I was like, it was one of those things of like, I'm not angry with you or anything like that. I'm just like, we're disagreeing on this, and that's totally fine.
Mhm.
If I'm disagreeing with something and I agree to disagree, that's not good.
Yeah.
Because with the TISM and the ADHD, I don't think I've ever agreed to disagree. You know, like that just ain't me.
Yeah. 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 Not to change gears, but I think we should talk about substance use.
We should, because I'm assuming the diva said she a diva. She got the AD and the HD.
Oh yeah. I mean, I can't score it because
Yeah.
I didn't ask you all the childhood questions,
But-
but first of all, I already know your answers
Yeah.
from screening you in the past, but yeah, a lot of those questions or examples relate to specific criteria in the DSM. So, you know, one of the criteria is easily distracted by external stimuli, but then I ask you about specific things
Right.
under that because it's a lot of times the DSM's just very clinical.
Yeah.
But substance use.
Yeah.
So they found that ADHD that is not treated by the age of 12 increases your risk of substance use. And that's like repeatedly that has been demonstrated
Right.
in research that treating ADHD reduces substance use risk and also reduces relapse. If you have a substance use problem, get sober and have your ADHD treated, which is a really controversial thing that I do and has actually gotten me like blacklisted from some substance use providers. They won't refer to me because they know that I will treat ADHD with evidence-based treatments, which
Yeah.
sometimes include stimulants. But I can't even tell you the amount of former substance users that I have that have ADHD that are sober for 2 years, 3 years, 5 years, 6 years. And they've taken ADHD medicine the whole time.
When I was finishing my graduate degree, I talked to you about an incident I had. I'm going to shuffle it around a little bit, where a client, 10 years sober, went to their OBGYN and was put on a very low dosage of Adderall because they had ADHD, stayed on a low dosage, was doing great, didn't relapse or anything like that, and was doing fine. And a psychiatrist at the place I was working at went off on me for not disclosing that to them. And I was like, well, you're not their med provider. They just have to see you to stay in, here. And what a very grotesque judgment that you're putting onto this person, who's functioning fantastically and is super calm for once and all these things. There's a lot of stigma. I always told you I will never. I first thought I wanted to be a psychiatrist and go back to school. I'm like, I never want to have to do the meds. But you're 100% right. Like, there's a stigma around it, but it's like I've seen some people just function better and not have the reason people bond to a substance with ADHD that goes undiagnosed is they want to. It does work sometimes. It calms you down. It is calming the brain down. And when you have a brain that's working at 1,000 miles an hour, it's exhausting.
Right. I mean, think about always being bored, not getting stuff done, being overwhelmed, being overstimulated, not being able to sit still, being impulsive, having poor decision making. It's a recipe for substance use.
Absolutely. And does the substance use include bonding to other things like
gambling,
sex,
shopping.
porn, shopping,
Yep.
eating? All these things are things that are stimulating, or it's giving us that dopamine. That again, that like I said before, people get this naturally from completing a task. Like we don't get that.
The problem is that it's dysregulated, right?
Yes.
It's not that you don't have it; it's that it's dysregulated. So when it's randomly firing in your brain, and you give a stimulant that delivers consistent dopamine. The brain downregulates in response, so you don't have that random firing.
Right. Like, I think that's right. When you're getting it at some point of the day, but not in a way that you can even find the pattern in, right? And I think, of course, like, and I think that's the frustrating thing with parents, like, but like, well, what can we do? This. I'm like, I absolutely don't always think that like this is the option. Like, they have to do this, they have to do this, they have to do that. But we have to treat it. We have to. If you don't want to start medication right away, that's fine. Then let's start. We got to start intensive therapy. Let them know they have ADHD and stuff like that. And like we have to do things that will really help their brain stimulate them.
So I just read a couple weeks ago this very large longitudinal study that showed that treating ADHD in adults reduces the risk of substance use. However, treating with an SSRI, individuals who take SSRIs, so Prozac, Paxil, Celexa, Luvox, Lexapro, Zoloft, it does not reduce your risk of substance use. But ADHD medication does.
Is it just because you're not being stimulated enough?
Well, I think that it's probably that I think there's a huge co-occurrence rate with substance use and ADHD, and there's a misdiagnosis of depression and anxiety. So treating depression and anxiety when the underlying problem is ADHD is not going to do anything to prevent or decrease the risk of substance use.
No, and again, like I said, meds and me aren't. But if someone has ADHD, right, and you're treating them only for depression and kind of lifting the mood a little bit, wouldn't that make some of the ADHD symptoms worse?
It can, but I think moreover than that, you're not getting to the root of the problem. So you're setting the person up for failure because they're depressed, because they're inefficient, they're bored,
So
they're
not really
restless,
helping either.
they're irritable, and emotional dysregulation and antidepressants does not go well typically.
No, it does not.
Yeah.
The first medicine I was on was Zoloft, and I thought it sent me into like a weird. I mean, the amount of times I'm not going to say the doctor's name. God, I almost said it though. That my PCP growing up in Little Goshen, Indiana, sent me into psychosis over medications that shouldn't have done that. I thought that my alarm clock was talking to me, and that my parents were going to lock me in my room and set it on fire. So, and like, you know what? Let's try lithium.
Right.
Zoloft's not working.
Right.
Yeah.
I think that's why a comprehensive evaluation is the best thing that you can do for yourself, and seeing someone who's board certified in psych is very helpful.
Say it again. Board certified in what?
Psych.
There we go.
Yes,
Okay.
yes.
I just want
not
everyone
in
to hear
family
that
medicine.
It's and I am not shit on family medicine
Not at
doctors
all.
because here's the thing, babes. They have. I mean, think about how many times a doctor's been able to fit you in that day, right? And they can see.
I mean, can you imagine a doctor treating like your fungal foot infection, and then you being like, "I can't focus and I'm depressed," and they're like, "I have 72 other people to see today." Like, I do not envy family medicine doctors. I would never be one. I think they are like some of the hardest working people on the face of the earth, and they also have the burden of treating mental health when that shouldn't be their responsibility.
No, because like anything else, like I will. Quite often, I stay in my lane. So if someone comes to me and I'm just like, I don't know. If I had, I'm trying to think of, there are things, I just feel like I shouldn't say them out. There are things that like, if people come to me, I'll send them. I referred kids all the time to Seth. Like yesterday I did that. I was like, hey, I have some people for you. I'm great with groups of children or like per instant with children. I know I'm also good with therapizing. I just don't want to. I just want to work with adults. But yeah, I think for PCPs, it's like not stay in your lane, but it's just like, this isn't what you were as well versed in as you are with the family med stuff. Go to someone that's board certified in psych.
You know, I think this whole episode is a great example of our ADHD and how it presents. And I think we probably should do a part 2.
I think this has to be part 2.
Yeah, because we also answered like 0 listener questions. But this episode might generate a lot of questions.
But that's what I was about to say, because there's still a bunch that we still have quite a bit more questions, but I think what it also does is it allows people to listen to the survey and listen to this and then be like, oh, these are the questions I have regarding that, you know? Because I think it is much more than what people think when you diagnose someone with ADHD, and then if they come to me as a client, all these, I didn't know it was this and this. I don't know why she was asking me this question. I realized it's because of this. I'm like, yeah, baby, that's...
And I mean, you got lucky that the first medication prescribed to you worked, but that doesn't always happen.
Oh, no. Yeah.
So, you know, I'm sure people have questions about medication also that luckily I am qualified to answer.
Yeah. Like, thank God, too. It's not often that you get a situation where the med provider also has a mental health person and they can like bounce off of each other or send them there, you know. You usually don't get that in-house. Right. You have to go to like 12 different places, you know? So you get that with us. No, I think we absolutely need to do part 2. I think specific talk about the personal burden that it carries and the rejection sensitivity, I think is game changer for people. Yeah. I don't think they realize that's part of their ADHD, baby.
And I think a lot of the research is super important too, because it's the person who is listening to this podcast and hearing these symptoms and thinking that could be me that's going to have to advocate for themselves.
100%.
Because there's a lot of providers that aren't going to look for it, that aren't going to believe it, that are going to gaslight you because they think you're drug seeking. And we could never reach people before the way we're able to reach people on Instagram, podcasts, TikTok, and it's helping.
They're seeing them. It's not, I hate when people like self-diagnosing. First off, you're the expert of you. I always will say that. If you're seeing something and it's resonating with you, someone said, if you're autistic and you're sitting there looking at symptoms of autism and you're doing it for hours a day and whatever, you're probably autistic, because people who aren't autistic would look at the symptoms and say, not me. You know what I mean? So it's like one of those things where it's like, yeah, if you're sitting there like, and take it to your doctor. Say it's not just I can't pay attention. It's these things. It's my rejection sensitivity is really bad. I feel like I'm burdening people. I can't sit still. I'm physically exhausted because I have to be up and moving around.
It's also like I've educated myself. I know some of the research that's out there. I've listened to podcasts that actually discuss evidence-based research. And it's saying like, no, this isn't just depression and anxiety. I'm living in this body. I'm functionally impaired by these things. And just keep advocating for yourself and go to a different provider if someone is not listening to you.
And I always say, too, be open and honest with them and be like, hey, like, I'm willing to try other medications if you don't put me on a stimulant right away. I just want to feel better, you know?
Yeah. And realize that ADHD likely will co-occur with other things. I would say in 15 years, I've maybe seen less than 10 people who only have ADHD.
100%.
Yeah.
We're doing a part 2 of this. Yeah. We have to.
Next week we'll do it.
Yeah, we'll do so ask all the questions that you have in the video. Message us on the weekly therapy Instagram. DM us there if you have questions after listening. Subscribe, and we'll answer them for you next time. All right?
Yes.
Bye.